I'm Farah Duro, and you're listening to the PCOS Revolution podcast. Hi, everyone. I am so happy to be back. I've missed all of you. I really do apologize for the long delay, but it was summer break. We did travel quite a bit, and I do have a busy practice as well, and as well as a big family. So we really have been having a great time over the summer, but now time to get back. And I really have been excited about hearing about your BBT charting that you've hopefully done over the summer as your homework that was assigned last time. So I'd love to hear back from you guys if you have tried your BBT charting that on paper or an app and you've seen changes in your cycle, just following some of the suggestions we talked about, like with your diet and also some exercise and herbal treatment. Just shoot me an email if you can. I would love to hear from you. You can connect with me on the website at floridacompletewellness.com. And, I really love hearing from you guys and reading your emails. And I've actually spoken to some of you during Skype consults, or over Zoom. So I really love hearing from you. So hopefully that's been working for you. You're starting to see some peaks and curves, and you're seeing definitely some distinct changes with your cycles. Today I wanted to talk about where we left off as far as if you are struggling with trying to get pregnant and having PCOS, what sort of treatments are out there that could be more successful? And we'll talk a little bit about the new guidelines that came out as I was traveling in Europe this summer. They published the 2018 first edition, brand new international PCOS guidelines from Australia. So I had been poring over those, lots of good information there. And we'll see if, as far as the changes go and the recommendations, these are now considered worldwide recommendations for women with PCOS. And I think this is the first time I've ever seen this happen where everyone has come together as a consensus as far as mostly, dealing with the symptoms of PCOS and what's been working and that sort of thing. So a lot to go over. But first, I want to kind of jump into some of our talk about fertility and why it's such an issue. We know with women with PCOS, the issue is ovulation typically, but there's other things at play. And the concept of regulating the menstrual cycle to promote fertility is not new. It's actually been emphasized for centuries. And as far as we're concerned as Chinese medicine practitioners in the Song Dynasty, which was 960 to 1279 CE, a doctor named Qin Ziming, probably got that wrong, the pronunciation, but Qin Ziming, he claimed that menstruation must be regulated first. If not, myriad illnesses may ensue. If menstruation is regular, the woman will get pregnant. Now, I know that it definitely is more involved in that, but that's Song Dynasty. A lot of the Chinese herbal formulas that we use today came from that particular time period for working with fertility. So basically, if you're one of those, it's in the United States, 6.1 million couples are struggling with fertility. You're definitely not alone. It's really comforting to know what options are available. And, with anything, you have to do your research, look into, what's not just what's working for your friend, but also what's working for people that are in your situation, your age range, your type of issue with fertility. I know some people will have, a lot of times we see in our clinic, overlapping diagnoses of perhaps endometriosis with PCOS, with problems with the fallopian tubes and male factor issues. So the more, basically a rule of thumb, the more complications we have, the longer it can take. So always a good idea to start this investigation a little early, even if you're not thinking of getting pregnant right now. Perhaps down the road, could be 5 years from now, but you want to look into what your body's doing. And that's one of the reasons we asked to chart as well. So with proper treatment, the good news is that 2 out of 3 couples will be successful in having a baby. And, earlier treatment is better. And that's everybody across the board emphasizes that if possible. And really, what is the definition of infertility? It's defined as the inability of couples of reproductive age to establish a pregnancy within 1 year through unprotected intercourse. And the basic causes are, they are estimating around 50% female, 35% male, 10% unexplained, and 5% other causes, which sometimes are considered autoimmune or not quite understood. So basically how we start out is we have, about 6 to 7 million eggs when we are in our mother's womb at about 20 weeks gestation. So our ovaries contain a ton of eggs, but unfortunately that starts to decline pretty quickly. So it goes down to 1 to 2 million by the time we're born. And by puberty, we're left with about 300 to 400,000 follicles in the ovaries. And of those, only 400 eggs are ovulated out in a lifetime until roughly age 51. Could be a little longer if you have PCOS when menopause occurs. So when we talk about, the amount of follicles that someone has, that's typically much higher in women with PCOS. So, but not all of those are completely mature. A lot of them are half developed. They're kind of hanging around the ovaries. And when someone does go for fertility treatment, there's a possibility of multiples because of all of those eggs getting stimulated at once. So when we look at the brain's role in hormone production, the brain is pretty busy doing a lot of things. And to understand the process of reproduction and how treatments like acupuncture and mind-body techniques work, it's important to look at the brain. So one area of the brain is called the anterior pituitary, and it's responsible for the production of hormones such as LH, which is luteinizing hormone, and FSH, and that stands for follicle stimulating hormone. And those both act on the ovaries. Next player is something called GnRH, gonadotropin releasing hormone. So it's released by the hypothalamus, also part of the brain that acts on the pituitary, and coordinated pulse frequency. So it's just continually released there, stimulating the pituitary. And other hormones that you might be familiar with would be estrogen, which is sometimes abbreviated like E2, and progesterone, which you might see written as P4, that act on the endometrium or the uterine lining, and they're produced by the growing follicle and the corpus luteum. So during pregnancy, the placenta assumes production of progesterone at about 10 to 12 weeks. And this is usually the time that your reproductive specialist will tell you just to stop any progesterone supplementation if you have had to supplement due to an IVF cycle or you've had to use it because you are low in progesterone. So you don't need it anymore after that. So during a normal menstrual cycle, progesterone and estrogen contribute to thickening the lining to allow for implantation. And just before your menses occurs, the estrogen and progesterone drop to allow for proper shedding of the endometrium. So imagine if you haven't had your period for 3 or 4 months, what's happening to that estrogen and what's happening to the lining? So a lot of women are very low in progesterone that have PCOS because they don't have, ovulation is not happening. So that corpus luteum is not producing progesterone. And, we see prolonged exposure to estrogens. The body completely does not shed the lining because ovulation is not happening. So it's just, a constant exposure to sometimes higher levels of estrogen without opposing progesterone. And so what happens when we look at this from a Chinese medicine perspective is that Chinese herbal treatment can help regulate the cycle by working with the distinct phases of the cycle. So for example, one of the formulas we use, we might have talked about this before. You've heard me talk about Blossom. Blossom is comprised of four herbal formulas. So there's one for each week of the month, beginning with phase 1 during the menstrual cycle and ending with phase 4. So usually we're recommending a course of treatment for at least 3 to 6 months when we don't have a consistent cycle present. So really that is our herbal treatment. If you are not seeing an herbalist and you are going to your reproductive specialist or gynecologist and you haven't had your period in over 3 months, a lot of times they're going to induce your cycle with progestin. So it's basically a synthetic or a progesterone like medication to help you shed your lining. Not necessarily encouraging ovulation, probably you're not. It's just basically so that you can prevent the buildup of the lining over time and doesn't expose you to a greater risk of endometrial cancer down the road. So if you haven't had your cycle in several months, it's a good thing to look at whether you do it herbally or whether you talk to your gynecologist about that. Don't let it go. We've seen some women come in who haven't had a cycle in a year, and I really think that might be too long to let that go. So basically once if you decide to do fertility medications, we really emphasize that, Chinese herbal medicine should be discontinued at the discretion of the treating reproductive specialists and acupuncturists so as not to interfere with proper medication dosage. Because how do we know that the estrogen that they're looking at in your blood isn't coming from the phytoestrogenic properties sometimes that are in the herbs? It's very distinct as far as what level, it's very specific as far as what level they want your estrogen progesterone to be. So that's why we usually, as our, as an acupuncture clinic and herbal clinic, we do recommend our patients to discontinue herbs. And I'll just share, with you a story about many, many years ago. And I actually had my first practice in Fort Lauderdale. And I was working with an reproductive specialist, an IVF doctor. Actually we had some difficult cases early on. I just remember working with PCOS and kind of feeling like I didn't have complete clarity. There were a lot of things that were unknown. So, and a lot of times we had cases where it was, for instance, one patient with one ovary, which was polycystic on one side, one fallopian tube on the other side, just one tube and one ovary. They're on opposite sides, blood clotting disorder, a rod in the spine, and on top of that, endometriosis. So that was one patient. And on top of that, she had 5 miscarriages before she saw me. So she was trying to conceive. This was her last shot, really. She had been emotionally exhausted. And I'd never really before her worked a lot with other women with PCOS. I knew how I kind of got control of my issues, but I had never worked with someone that had so many complications. So I really will always remember her because when we started working together, I told her that I didn't think I could help her because, for one, she wanted to get pregnant on her own without IVF. And then, I thought, well, you have one tube over here, one ovary over there. That poor ovary's been working so hard. Yet you are getting pregnant naturally, but you're not holding them. So I just didn't want to see her, continue to go through what she'd gone through. But she said, no, I'm going to give this a try. Whether you help me or not, I would like your help, though. And so I did talk to her reproductive specialist, and we agreed that when she got pregnant, he was going to actually put her on blood thinners. And so we actually used Chinese herbs in her case, to help with her circulation, calm her immune system, and also the inflammation going on in her body. She was always in a lot of pain as well from the severe scoliosis and rod in her spine. And, working with acupuncture and herbal medicine, she did conceive. Immediately, we called her doctor, and he put her on heparin at the time is what it was, injections to help her as an anticoagulant treatment to help prevent, hopefully, another miscarriage. She actually carried to term. She had a healthy little girl, and what's happening with in her body, actually we could see this, that the fallopian tube on one side was reaching over and grabbing that egg from the other side. So that was pretty amazing. And after that, I said, I think that we can never say no. Like, pretty much, if she got pregnant and she carried a term like that, and she even had a pretty healthy pregnancy, I think that that anything's possible. possible. So after that, I really was very encouraged and super happy and excited for her. She would send Christmas cards every year, and that was pretty amazing story. So after her, I saw a patient who had come in, and she actually wrote a letter after her treatment when she conceived, not once, not twice, not 3 times, but 4. So she has 4 children now, and she had pretty, I guess, severe case of PCOS, where she had about 6 to 10 menstrual cycles a year, but they just were not predictable at all. So she had really heavy, painful periods where she was just doubled over with pain and in bed for even 2 to 3 days, and she had moodiness, irritability, and acne, and all kinds of things. So basically, she was referred to a dermatologist and tried many different prescriptions and microdermabrasion and all kinds of things, and nothing really worked for her acne. But she didn't want to go on Accutane because she was trying to also get pregnant. So basically, she was diagnosed with PCOS through her endocrinologist. And, she basically just wasn't sure. She didn't want to be on birth control, obviously, because she was trying to get pregnant. And she was placed on birth control during her teenage years and early 20s. And she really didn't feel good on them. So like a lot of us, it's not for everybody. So basically, she was trying to research what things would be helpful. And she was around 30 years old, and she came upon my website, and she decided to try acupuncture. And, we tried at her temperatures. That's how we started. So let's see where you are. She came in weekly. We basically, every week was like a report card with the BBT, like, are your temperatures changing? What's going on with your cycle? She was taking Chinese herbs that tasted horrible, I know. But basically, she wasn't on any prescription medication. Her acne started to clear up is what she first noticed, along with her PMS. The cycles were still pretty far out, like 40 to 50 days, but they were getting closer. She also noticed that she was less moody and irritable. So that started happening, and she never got a pimple again, which is pretty cool. So once the hormones balanced, she actually started becoming more regular as far as, with her cycles. And so 4 months after starting her treatment with acupuncture, she conceived her first child. So she was extremely happy. She came in during pregnancy as well. For acupuncture. And this was a patient who was told that really she wasn't going to be able to conceive without medication. So I think that, the best part was that we did her pregnancy test in the office because, at the time, it was many years ago, we decided, well, we're going to keep, some pregnancy tests on hand just in case, because we never know if we're actually going to be treating someone and with a very late cycle that might be pregnant, and we're recommending herbs, so we have to be careful with that. So we went ahead and she brought in her BBT chart and said, look, it's like 2 pages and it just keeps going up, and I'm not getting my period yet, and I thought I was here to help regulate my cycle. So I looked at the temperatures and I said, I saw 3 peaks, so each one going up higher and higher. I said, let's just go ahead and take a pregnancy test, and sure enough, she was pregnant. So that was one of the, I guess, the best examples of using those temperatures to really know what's going on too, because really, had she not, then she would think, okay, I'm just having another late cycle, and eventually would have tested and seen that it was positive. But I've had women who've come in with PCOS that were 4 months pregnant, had no idea they were pregnant, because it's very hard when you're having, 6 periods a year to know sometimes. So that's another reason I'm a big proponent of the BBT charting. So that's an example of how acupuncture, herbal medicine, BBT charting, and we did make some tweaks to the diet, things like that would really help. I will also say that she was not on metformin either, because she did not opt to do that, because her diet she did clean up her diet quite a bit. In the new recommendations that I was reading over, it's still emphasizing that diet and lifestyle are the first tier of treatment. I mean, it is basically saying use metformin if the diet lifestyle changes are not going on. So it's not 100% everybody needs to be on metformin or birth control for that matter. But, basically diet lifestyle is still number one. And I really honestly believe that is, the best course, obviously. So if you can, I mean, in some really, I really think this is all about taking charge of your health. And the new recommendations, I will jump into that, really still say that, you do need to have irregular cycles and some symptoms of hyperandrogenism to be diagnosed with PCOS. So it's still following the Rotterdam criteria. And I made so many notes going through this because I really wanted to understand it better, but also wanted to kind of communicate it to you guys because it's about 120 something, 30 pages. So it's great to read through. I will put the link up, and I want to thank the societies that came together to actually do the research and put it out there. So basically looking at tying in the diagnosis of PCOS and trying to get pregnant, basically if you have those factors, they do need to check your testosterone levels. And after that, if those testosterone levels are high, they should check your DHEA levels. So this is all part of a workup done at your gynecologist, or if you go to a reproductive specialist, if you're considering that, and then those things that, they automatically do that usually. That being said, sometimes we don't see that in the blood work. We don't see the testosterone being checked. So if you have irregular cycles and you have abnormal hair growth or you have a lot of acne, I would just go ahead and check and ask if you could please check my testosterone. It should be your free testosterone or total testosterone. And if that's high, they will check your DHEA, which is another androgen level. You don't need to use an ultrasound to diagnose PCOS. So that's another thing. If you are taking birth control, you need to actually stop birth control for at least 3 months before getting these tests done, because birth control will actually kind of skew the results of your androgen panel, so your testosterone DHEA levels. Another point was that some people wonder about abnormal hair growth, and they look at their face and they notice that they have a lot of baby hair on their face. That's called vellus hair. And vellus hair is not considered hirsutism. For our purposes, it does not include vellus hair. So if you have the baby hairs and you're wondering, like, what the heck? There's so many hairs here. I wonder if this is PCOS. A lot of times that's just genetic or a normal part of your skin, and basically the hairs they're talking about are your terminal hairs that actually are the ones that grow pretty long if you don't pluck them or shave. So that's another differentiator when you're looking at at PCOS. And, women who actually are in menopause still can have PCOS. I was actually told one day by a specialist, like, no, if you're in menopause, then we don't consider you having PCOS anymore. And I was very confused by that. And I said, wait, how does it magically disappear? So it doesn't. It actually, what happens when you go into menopause with PCOS, your testosterone can be elevated, yet your cycles are going to be discontinued, usually. It could take longer for you to go into menopause because of all the eggs, perhaps, that are still there, or, having fewer cycles and that sort of thing. So that's one of the takeaways there, and actually they recommended that everybody be monitored, at least for cardiovascular risk factors if you have PCOS, especially if you're overweight. Everyone should have a glucose tolerance test. This is a lot of times part of fertility workups as well. So if you are going to a gynecologist, you might have to ask them specifically for this. It's called an oral glucose tolerance test. That should be done as a baseline, and then once every 1 to 3 years. If you're trying to conceive, this is actually done right away as a baseline, because when you try to conceive and you're also pregnant, they need to do this midway through the pregnancy as well. So that's pretty routine typically, but it's not routine to have this done prior to getting pregnant a lot of times. So if you have PCOS and you're not really under the care of a physician, or you're not seeking fertility treatment, then you can talk to your primary doctor about this. It's really, pretty easy. It's not easy. It's kind of a pain to do it, but you are going to be usually drinking some pretty nasty tasting stuff, and they're going to check your glucose how it responds throughout that test, and they'll see if you do have what your glycemic status is. And that could be a baseline for you. So that's important. A lot of things are mentioned about quality of life. If you have anxiety and depression, that's actually, as we talked about before, one of the hallmark signs of PCOS could be that there are some issues with anxiety and depression. They really were very specific to say, be careful when you're prescribing medications for this, because a lot of those medications can cause, guess what, weight gain. So that's not what we want. So a lot of times they're actually emphasizing other treatments like cognitive therapy or going to a psychologist, exercise, lifestyle changes, those things. But, considering other things before drugs, unless there is a specific need for that. So those are, as far as getting into this, I really think that this needs to be addressed more. The problem is that it's sometimes hard to see, because PCOS is so underdiagnosed, that you might see someone who is suffering from a psychological condition or depression and anxiety, and sort of overlook the PCOS and just give a antidepressant or an anxiolytic, and have that patient not get better, but also have the weight gain on top of the PCOS now as well. And you just exacerbated the problem. So we do see that a lot. And sometimes it's actually combined with other medications as well. And you do have a risk of interactions too. So I just, there's so many good alternatives. That's what we've gotten into with other episodes. If you want to listen to Deborah Beaumont's episode, we talked about that. So, that's just something to watch out for, especially if you are pregnant or you're trying to conceive. Some of these medications should not be taken during pregnancy. So, really, I think that having an understanding of, if your doctor is familiar with PCOS, obviously a lot of the reproductive specialists that we work with are, and others around the country are experts in this. They're going to know these guidelines already, but it's also good for you to know it, because you might be in an area where you don't have someone that you're seeing on a regular basis, or your gynecologist might not, be familiar with PCOS. So you can see that these guidelines actually are in place for you to take the power back also and take care of yourself better. And really know that, if you're not getting some of these tests done, that you probably need to at some point. It could be during a yearly physical. If you're trying to conceive, these are preconception recommendations. And as far as our patients go, we like to have an integrative approach. We do want to see tests done by their gynecologist or their IVF doctor, and we want to incorporate those findings into our treatment. And we also want to have respect for what they're taking as well. So, if you have an integrative approach, you still need these tests to be done even more so, because especially if you're working with supplements or you're trying to conceive, that's very important. So that being said, I know we've kind of gotten a little bit off track, but not really. I just wanted to give you guys a little bit of clarity as far as the different options you have. I mean, there are so many things out there, but it all starts with really taking charge of your cycle, figuring out what's going on there. If you are charting, really looking at that chart and seeing the shifts there, and bringing that to your acupuncturist or your gynecologist and saying, look, it's flatline, like I'm not ovulating, what can help? And then from there, whether it be letrozole, which is the first line recommendation now with these new guidelines for a medicated treatment that's actually going to help with ovulation, or it be an herbal route, or it be a combination of that, or acupuncture, that chart is going to be like your report card. So I really hope that you guys are having good success with that. And if you ever want to get in touch with me, my website is floridacompletewellness.com, and my email is fduro, like F like Frank, D like David, URO at floridacompletewellness.com. And I hope you guys have a fabulous rest of your week and weekend. Please let me know if you have any questions at all, and I look forward to talking again. Thank you.
And that's the end of this episode of the PCOS Revolution podcast. If you've enjoyed the show and want to help me spread the word about how women with PCOS and hormonal imbalances can lead happier, more healthier lives, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to have a question answered on the show or would like to recommend a guest, please go to floridacompletewellness.com/podcast. If you're on social media, you can follow me at facebook.com/Florida Complete Wellness and twitter.com/Florida Complete, where I post a lot of interesting research, webinars, and articles on our blog about really getting to the root of hormonal imbalances like PCOS. So it's a great way to stay in touch with the latest developments. Thanks so much for listening, and see you soon.